Hi, I'm Joe Feeks, editor of Poultry Health Today, and with me is Kellan Cookson. He's a veterinarian and director of clinical research for Zoetis. Kellan, thanks for joining us. I wanted to talk with you about infectious bursal disease, otherwise known as IBD. Vaccinating for IBD is fairly common on the broiler breeder side of the business, but I understand that you're seeing more and more broiler producers opt for IBD vaccination as well.
Yeah, the strategy has always been to focus the immunity from the passive standpoint, focusing on breeder vaccination, passing high relevant maternal antibody levels to their progeny. And really that is the single most effective strategy for preventing early infections, especially variant challenge, which we have predominantly in the US. But more and more people have found that there's added value by addressing vaccination on the broiler side. It's certainly not a replacement for the breeder strategy and that passive immunity, but it can be complementary. And so, especially with the advent of the recombinant vaccines, which by themselves carry no effect on the bursa itself, people have so when they do posting sessions and they see better bursal health, they can conclude that what they're looking at is directly the effect of the field challenge. And so when they see improved bursal performance, they can correlate that with that vaccine intervention. Along with that, people have felt like they get a performance kick out of vaccine intervention. So that single vaccine, I think, has reminded people that we can do things on the broiler side to dampen the effect of field challenge, and it can complement what we do on the breeder side, so we can get an even greater return on our investment.
So for broilers, if you wanted to not just vaccinate the broiler breeders, but also vaccinate the broilers, what kind of vaccination schedule would you be looking at?
That can vary widely. If you're just using what I would call a conventional live program, it can be either just in ovo with a mild vaccine and then nothing, or it can be just field vaccination. If someone is Newcastle bronchitis vaccinating at, say, 16, 17 days of age, they would mix that in with that respiratory vaccine. Or people that are not field boosting for respiratory, they might go in at, say, 8 to 10 days of age. Fewer people would have both those strategies, where they would give a mild in the hatchery and then follow that up with a field vaccination. Now, we did studies years ago that demonstrated that there was an advantage to vaccinating in the hatchery even with mild products. It seemed to complement their maternal antibody levels. So the net sum of that is they could delay the onset of field challenge by another 2 to 3 days. Mild vaccines by themselves will never prevent infections, but we hope that we can extend that time of coverage.
Now, you recently did some other comparison trials with different types of vaccines for managing IBD. Could you tell me about those?
Well, we did a controlled vaccination challenge study a while back, where we compared an immune complexed IBD vaccine. So it's a combination of a strong IBD vaccine live that's complex with antibodies to IBD-V. And we compared that to a recombinant vaccine. So two very different strategies that, number one, if you're going to apply an IBD vaccine in the hatchery, it has to be safe. If it's not safe, then it's over. So that's the number one thing. And so that's the number one strategy with the immune complex vaccine, is to protect the bird from the vaccine at a young age. so that there can be no immune suppression caused by vaccination. But by the mechanism of that product, it delays the onset of infection, which also interacts with the levels of maternal antibodies that each individual bird has. And the end result of that is each individual bird goes through the vaccine infection when their maternal antibodies are low enough that they're ready to respond.
Now, you mentioned the recombinant vaccine. I know that producers have really embraced those, not just for IBD, but for Newcastle and ILT and so forth, because they have a good safety record. Why not just use a vaccine like that, or there's some other advantages to using some of the older products?
Right. Well, one of the biggest conflicts with recombinant vaccine usage is you can only use one HVT vaccine at a time. Invariably, one of the HVT products is going to replicate differently than the other and will out-express the other. The cargo, the DNA, that it's carrying. And so, for all intents and purposes, you can only use one HVT vector at a time. So that's one limitation of those products. So if, especially in the winter months, HVT Newcastle, recombinant Newcastle, is a very popular choice. So, in the winter time, at the same time, that's our highest IBDV challenge. So obviously someone has to make a choice. If they're enamored with both recombinant vaccines, but it's more appropriate to use the HVT Newcastle recombinant in the wintertime, then what other options are there? That's where you have your conventional live products and your immune complexed live vaccine.
So you only get one shot then with the recombinant vaccine, so you just kind of have to pick your battles wisely, I guess.
Correct.
Okay. I remember a presentation that you made last week. You talked about the recombinant vaccine not always managing the reinfection. Could you speak to that a little bit?
And we see this with for example, the LT recombinant vaccine. We see the same thing. The recombinant HVT vaccines don't prevent infections. They can reduce the load of infection, and they can reduce the damage caused by those infections. So that's their primary value to the customer, is they minimize the effects of the challenge. They can hopefully reduce the level of challenge, but never would reach the same levels of control. For example, on the LT side, using a chick embryo origin vaccine, you get almost what we call a sterilizing immunity with a live vaccine that you don't get with a recombinant. And the same thing we're seeing with the IBD recombinants as well. They buffer that challenge. They probably reduce the load, but they do not prevent infections. So what you have is the next cycle of birds being placed in an environment, they're still going to see that challenge virus.
Let's talk about the field challenge then, as far as the difference in what you would expect to see with different types of vaccination programs.
Well, that's interesting in that, our field challenge in the U.S. is, I don't know if we pride ourselves in we have a very high field challenge, but that's a fact of nature. We have a very high field challenge because we grow our birds on built-up litter often, and we have not only a high challenge, but it's a high variant challenge. Almost everything that we isolate from broiler flocks is a variant challenge in nature, and most of that is a new type variant virus challenge that isn't a perfect match for our breeder vaccines. So there are opportunities with the broiler interventions. What's interesting is what looks like they're the two most effective products on the broiler side are essentially what you would call classic vaccines. Okay, so your recombinant vaccines, or at least the main product being used in the U.S. successfully, contains a classic IBD insert, VP2. The immune complex vaccine that's tested very well in this high challenge variant environment is also a classic vaccine. So going into studies this year in field trials, we weren't sure exactly how the immune complex vaccine would perform in this environment. It's not a new product from a global standpoint. It's been used for years in other parts of the world and done quite well, but those challenges are more or less classic in nature and not tend to be as high. So when we tested that type product in the high variant challenge environment of the United States, we weren't sure exactly how that was going to translate. And the bottom line is it's translated pretty well. We're seeing a softening of the blow to the variant challenge, just like is seen with other vaccine strategies.
With IBD, are there some diagnostics that you can do ahead of time to try to determine what sort of vaccines you should be using?
Well, really the best tests are it's all about the bird. The bird tells us. The bird doesn't have its own agenda. So if you want to really understand what the issue is with a given disease, go to the bird. And so that's what we do with IBDV. We generally will take bursal samples at 3 and 4 weeks of age, and that gives us a good window to determine when is the onset of infection and how is that infection, how is it going through that flock? Is it going through and sustaining? Is it going through and then just really creating great damage? Because timing of infection is critical. If you have flocks that are getting infected by 14 to 16 days of age, they're at a much greater risk of permanent and significant immune suppression than a flock that's going through an infection at 21 to 23 days of age. So timing is crucial. And the other part of that analysis is PCR. So you first find out what's the timing of infection, and then what does that virus look like that's causing that timing of infection. If it's a Delaware E virus, then more likely than not, your breeder program is going to be throwing the right antibodies to the progeny. If it's more like a new type variant like AL2, then we would look more at the breeder program in addition to any interventions we could do on the broiler side.
So, in summary, how should producers and veterinarians go about planning their vaccination strategy? You mentioned diagnostics and so forth, and that would be a big part of it, but are there some general rules that people should follow when they're putting their vaccination program together?
Well, on the breeder side, you want to make sure you have a good priming program, and that's the live vaccines that are setting up the birds so that they'll respond well to the subsequent kill vaccines. We're big proponents on broadening the spectrum of antigens that you present to the breeder hen to broaden the antibodies that they pass on to the progeny. So broader cross protection covers more bases and delays that onset of infection. Broiler side, I don't think antigen selection is as critical. What's more critical is that you get a vaccine to the bird that it has a response to, that response then creates a buffer to the field challenge. And so today, the most effective products that are on the market are, what I can tell, are Recombinant with a classic insert and the immune complex classic vaccine.
Well, Kellan, you've given us a lot to think about with IBD. Really appreciate your answering all my questions. We've been talking to Kellan Cookson, veterinarian and director of clinical research at Zoetis. Thank you, Kellan.